Ever wondered why you might feel constantly tired or why you're gaining weight inexplicably? Could it be your thyroid? Hypothyroidism or underactive thyroid might be the culprit. The thyroid, a small butterfly-shaped gland located in our neck, plays a crucial role in our body. It's responsible for producing hormones that regulate our metabolism, energy levels, and even our heart rate. When the thyroid doesn't produce enough of these hormones, we can start to experience symptoms like fatigue, unexplained weight gain, and even depression. It's a condition that can be quite elusive, often going unnoticed until it starts significantly impacting our lives. This is why it's so important to understand our thyroid health and be mindful of these potential signs. But don't worry, we have a solution to this problem, and it's called levothyroxine. So what exactly is this levothyroxine we're talking about? Well, let's dive right in. Levothyroxine is a medication that plays a pivotal role in the world of medicine, particularly in treating a condition known as hypothyroidism. This condition is characterized by an underactive thyroid, a small butterfly-shaped gland located at the base of your neck just below your Adam's apple. This gland has a big job, producing thyroid hormones that influence virtually every organ in your body. When it's not quite up to speed, that's where levothyroxine comes in. This medication is not exclusive to adults. Children who are dealing with hypothyroidism can also benefit from levothyroxine, but its applications don't stop there. In adults, levothyroxine is also used to treat a specific type of thyroid cancer and a severe form of hypothyroidism known as myxedema coma. Now you might be wondering, how does levothyroxine do its job? It's simple yet fascinating. Levothyroxine works by replacing the thyroid hormone in the body. You see, thyroid hormones are essential for our metabolism, the process by which our body converts food into energy. When the thyroid gland is underactive, it doesn't produce enough of these hormones. Levothyroxine steps in to fill the gap, replenishing the thyroid hormone levels and helping to restore normal metabolism. But here's a word of caution. While it may be tempting to see levothyroxine as a magic bullet for weight loss, it's important to remember that it's not intended to treat obesity or weight problems. Using it in this way could lead to serious complications. Now, don't get me wrong, levothyroxine is indeed a lifesaver for many people dealing with thyroid issues. But like all medications, it needs to be used responsibly and as prescribed by a healthcare professional. It's quite a marvel, don't you think? But remember, every medication comes with its set of precautions. While levothyroxine can be a life changer, it's important to be aware of the potential side effects. Like any medication, it carries the risk of both common and serious side effects that you need to look out for. Common side effects may include symptoms like fever, tiredness, skin rash, and changes in appetite. It's important to remember that these side effects are relatively normal. However, if they persist or worsen over time, it's crucial to consult with your healthcare provider promptly. More serious side effects are less common but require immediate medical attention. You should seek help if you experience fast or irregular heartbeats, chest pain spreading to the jaw or shoulder, wheezing, or high blood sugar. These could be signs of a serious condition that needs immediate intervention. It's also crucial to note that levothyroxine is not a weight loss drug. It should never be used to treat obesity or weight problems. Misusing levothyroxine in this way can lead to serious health complications, including heart problems and even death. Additionally, it's important to inform your doctor of any other medical conditions or medications you are taking before starting levothyroxine. Certain foods and medications can interfere with how levothyroxine works in your body, reducing its effectiveness or causing other unintended side effects. Remember, the goal of taking levothyroxine is to help manage your hypothyroidism, not to create an entirely new set of health problems. It's crucial to use the medication responsibly, following your doctor's instructions to the letter. Always remember, your health comes first. So let's talk about some best practices when taking levothyroxine. Taking medication correctly is as important as taking the right medication. This is especially true for levothyroxine, a medication used to treat hypothyroidism and certain types of thyroid cancer. It's crucial to follow your doctor's prescription to the letter when taking this medication, as the dosage is often tailored to your specific needs and condition. Levothyroxine works by replacing the thyroid hormone in the body, thereby helping to maintain normal growth and metabolism. However, its effectiveness can be influenced by certain foods and medications. For instance, food and drinks high in caffeine or soy, certain types of fiber, and even some medications can interfere with how your body absorbs levothyroxine. Therefore, it's recommended to take your dose on an empty stomach, ideally in the morning. and wait at least 30 minutes before eating or drinking anything other than water. It's also important to be aware that certain medications, including some types of antacids, iron, and calcium supplements, can also affect how well your body absorbs levothyroxine. If you need to take any of these, it's best to do so at least 4 hours apart from your levothyroxine dose. Furthermore, it's key to inform your doctor of any other medical conditions you may have, or other medications you are taking, before starting on levothyroxine. This is to ensure that the medication can work effectively and safely for you. Remember, levothyroxine should not be used to treat obesity or weight problems. Misusing it in such a way can cause serious side effects, including irregular heartbeats and chest pain. Lastly, keep in mind that while levothyroxine can help manage your symptoms, it's not a cure for hypothyroidism or thyroid cancer. Regular checkups with your doctor are crucial to monitor your condition and adjust your medication as needed. With the right knowledge and practices, you can manage your thyroid health effectively. So remember, take your levothyroxine as prescribed, avoid foods and medications that can interfere with its absorption, and keep your doctor informed about your overall health and medication regimen. So, we've covered quite a bit today about levothyroxine and thyroid health. We started our journey by understanding hypothyroidism, the underactive thyroid condition that affects both adults and children. It's a condition that can significantly impact a person's life, but with the right medication, it can be managed effectively. This leads us to levothyroxine, the superhero of our story. It swoops in to replace the missing thyroid hormone in the body, a crucial player in regulating our metabolism. We learned that levothyroxine is not just a treatment for hypothyroidism, but also a certain type of thyroid cancer and the severe condition known as myxedema coma. But as with every superhero, there are challenges. We discussed the side effects of levothyroxine, which can range from the common ones like fever, tiredness, and changes in appetite, to the more serious ones like fast or irregular heartbeats and high blood sugar. We also learned that it's important to be aware of these side effects, as they can be indicators that the dosage needs adjustment. But hey, don't let these potential side effects scare you. We also gave you a guide on the best practices while on levothyroxine. Remember, it's crucial to follow your doctor's instructions to the letter, avoid certain foods and medications that can interfere with its effectiveness, and always inform your doctor about any other medical conditions or medications you're taking. And very importantly, we discussed that levothyroxine is not a weight loss drug. It's a medicine designed to bring balance to your thyroid function, not to be used as a quick fix for obesity or weight issues. In a nutshell, levothyroxine is a vital medication for those with hypothyroidism, but like any medication, it should be used responsibly and under the guidance of a healthcare professional. Thank you for joining us today on Explained. Please don't forget to subscribe to our channel for more insightful health discussions.